when I hit
Great.
record. So hopefully everyone got that message and you can consent to that if that feels comfortable.
Perfect. Thank you. I have a 6-year-old niece and she lives with us, and this is making me think of it because of Claire and I both saying we felt sluggish. She really likes the movie Sing, which is like animated animal characters that sing. And we watched the second version last night, and it has a slug in it that sings. So I just keep picturing that slug going across the screen as we feel sluggish, but okay, Claire, I think we can go ahead and get it started. So thanks everybody for joining. We may have more folks coming in as we have started to kind of do the chat. And you're welcome to put in your internal weather and external weather and share a little bit about that. I am Megan Bradley. I use she, her, hers pronouns, and I work at Share Our Strength on the Cooking Matters campaign. And I have been kind of behind the scenes, I would say, with a lot of this work, but I appreciate Claire getting to bring me in as we kind of wrap up and kind of explain what we've done over the past few months and where we've landed. So Claire, I'll pass it to you.
Sorry, y'all. I had to make a switch to my monitors and I am very confused and overwhelmed with two now. Maybe not the best timing to do that, but it's so nice to see everyone and to see like such a good group of folks. I'm Claire and my last name's Ladegzadeh. I use she, her pronouns. And I've been working with the FFORC team for a few years and helped kind of lead this design thinking process starting in March of 2020. So it's been such a meaningful experience and ride with a lot of folks, and it felt really special to be able to gather again with y'all to share kind of where we landed at the end of our about 2 years of doing this work. So we'll be sharing that, and then hopefully just having some time to invite y'all in to reflect with us and think through how we make this work impactful and meaningful moving forward.
Awesome. Thanks, Claire. And as folks join, you're welcome to put in your internal and external weather in the chat. And our kind of shared expectations for this time are still true for what we've had always. So take care of yourself and those in your space. Cameras on or cameras off, whatever you're comfortable with. If you need to step away, also okay. And then feel free to ask questions, ask comments or give comments, things like that, but making sure that we continue to have that space. So thanks folks for sharing their internal and external weather. We actually have a lot of the project team on the call, so that's really exciting. This was a very, as Claire said, it was, it's taken a lot of twists and turns as we've gone, and we couldn't have done this without everybody here on this slide and all the work they put into it. So these are all the folks who helped with interviews. You may have talked with them. They, all of the pieces. So since everybody is on the phone, if you want to, you're welcome to unmute and say hello, but we just wanted to make sure we were showing faces and names of all the folks behind the work. Okay. All right, next slide. So this is tiny, but it kind of helps you see kind of where we started. So we wanted to show, some of you may have been a part of just a portion of this project. So we actually started in March of 2020. We launched the project with the intention to use design thinking to better understand what parents and caregivers, as well as a large variety of stakeholders, were looking for in terms of food skills education related to some very specific settings. As you all know, COVID also came at that same time. And so we had intended to do everything in person and really kind of go to different places, and we had to pivot and move to virtual. And we'll speak to kind of some of the lessons learned about that. But we were able to pivot, and July is when we started doing inspiration sessions. So talking with a variety of caregivers around the food retail kind of setting and figuring out what would that look like. And in November, we ended with a toolkit that kind of speaks to all that you all shared about your ideas for interventions, your thoughts on how to partner, lived experience, and knowledge around the food retail setting. We also then kicked off in March of 2021, we kicked off our ECE setting. And so we talked to parents and caregivers around what that would look like for nutrition education or food skills education in that setting. And in June of 2021, we walked away with the roadmap. Both of these resources are available on the SnapEd toolkit, and we'll put the links in as well. But both of those were kind of the outcomes of those two settings. As we moved into August of 2021, we really wanted to think through how are we disseminating this information and how are we sharing it with others. So we offered a webinar. We also then, luckily, the UNC FFORC team took on an additional setting of healthcare and helped us really think through what are parents and caregivers and stakeholders looking for in that setting as well. And so that kind of gets us to where we are today. We are hoping to wrap it up. So as a part of design thinking, it's not only important to ground ourselves in how we're doing and our lived experience, but also make sure that we're all coming back together to share kind of what we learned and to get your feedback on what we ended with. Next slide. So something that was, as I spoke to before, we had intended to have this be in person. And I think we really wrestled. I think that's a fair word, Claire, with like, what do we do now that we have to switch to kind of a virtual space? And is now the right time to even do this project? Like, should we just put everything on hold? And so this quote really, I think, highlights kind of this idea that we needed to ask, right? We needed to make every effort to engage end users. Otherwise, we'd be making an assumption that it would be burdensome without confirming that. And so we really dug deep with folks. And with that, we had some kind of findings. So we learned, and also Jared is on this call, he put together a great article on this around kind of the virtual space and what we learned through that. So also just wanting to give him a shout out. But as you can see on the slide, we learned kind of like how people's comfort level was with web-based platforms and with Zoom. We learned that people were actually really interested in connecting and appreciated the chance to just connect, whether that was joy, stress, concern, but just feeling kind of isolated and desiring the chance to connect and share. And that people wanted more time. So today we have an hour, a little bit over an hour, and we may or may not use all of that time. But a big thing we learned through this 2 years is that in order to make sure we're giving and receiving and listening to in an authentic way, we really had to make space for that. And what we heard usually was an hour and a half to 2 hours. So we took that and have kind of used that feedback right away. So next slide. So before we dive into thinking about what we took away, and Claire will go into like, what did we learn in each setting? What are we hoping to do next? And how are we going to share this? I'd love to see if you all, you can unmute yourself, or you can chat it in, or you can say, I would prefer not to answer. But we wanted to better understand from you all, what was the most meaningful part of this project for you? There's no right or wrong answer. And it really is just a chance for us to reflect on being a part of this collectively. So I will pause and see if anybody wants to share. You see my head nodding. I'm just reading the chat as you all share. I always realize I'm on camera and you all can see me. Awesome. So enjoying the brainstorming sessions, hearing other people's experiences, meaningful to work with other folks and different perspectives, being invited to help, and getting to build relationships across the country. Awesome. Yeah, when Claire and I were reflecting on this reflection question, I just have just been really, it's been like the only word I can think of is like life-giving. Like it just gave me hope and it gave me excitement during a time that maybe I wouldn't have had as much of that. So I just like appreciated how authentically everybody showed up as their true self and was willing to share with us what they liked, didn't, and everything in between. So I really appreciated that candor. Awesome. The brainstorming, hearing other people's experiences, how people problem solve, hearing different voices and collaborating in the shared space. Part of something bigger. I appreciate that as well. And commonalities in folks' experiences and seeing how supportive folks are. Well, thank you. Those are great. I appreciate everyone again, just kind of sharing their experience. As I pass it to Claire, we're going to go through and share kind of what we learned. And if there are parts of this as we move forward that you're like, oh, that doesn't resonate with me, or that didn't feel true to me, or I really want to like say something about that, always feel free to pause and ask questions. I'll be monitoring the chat as Claire takes over, but this is our chance to share back, but also a chance for you all to continue that feedback loop if there are things that you are just surprised by or have questions about. So I will pass it to you, Claire.
Thank you, Megan. So I know y'all all touched the project at different points, and Megan alluded this to a bit, but we spent a lot of time between like March and July before we even started inviting people into those virtual spaces with us, trying to think about, you know, what are we really trying to do with this project? What are we really trying to use design thinking methods to learn about, to problem solve through? And after a lot of conversation with key informant interviews or key informants that worked with SNAP-Ed or did design thinking as kind of their primary work, as well as with Cooking Matters and the funders at Robert Wood Johnson Foundation, we kind of landed on two design questions to help ground us. The first was, how might we design a robust SNAP-Ed experience in places where caregivers of young children frequent in order to support their health and wellness goals? And then how might this experience drive SNAP-Ed impact and reach at the sectors of influence level? And sectors of influence level is a bit of a wonky term in SNAP-Ed, but it really means what are those bigger sectors in our society that influence health, and those could include healthcare, education, food industry and agriculture, marketing. So these kind of bigger forces that we typically don't see or interact with on a day-to-day basis, but we're kind of interacting with them in smaller settings. So there are kind of 9 defined sectors that SNAP-Ed considers. And our first mission, really, our first task was trying to work with caregivers of young children to understand what are the sectors that would be most impactful, most meaningful for us to work with in order to start shaping or shifting some of those experiences for them. And through that process, 3 sectors kind of rose to the top. And within those sectors, we had places or locations that would be ideal to start doing this work in. And they were the food industry, and particularly thinking about grocery stores, the public health and healthcare sector, and particularly looking at primary care offices or pediatric offices, and then education, and really looking at early childcare education centers. So those are the three that we worked on, and I didn't really include a lot of methods slides because y'all were very intimately involved with those. But within each sector, the general way that we moved through it was starting with about 8 to 10 hours of sessions with caregivers, so our primary user, and then taking what we learned in terms of what is most important, most desirable for them, most sticky or painful in terms of things we might need to problem solve around, and ideas for how to do that to a group of people who had various different roles to play in potentially implementing those solutions. So for food retail, that looked like in-store dietitians. In the ECE sector, that looked like a director or TA provider to those centers. And then in the primary care offices, that included people like medical directors, pediatricians, community health program managers. So for example, some of the folks. And then of course, the other people we engage throughout this process are the people who deliver and implement SNAP-Ed programming as people who might be developing the content, applying for the funding to do some of this work, and then of course, evaluating it and engaging people in communities. So we worked with, when I kind of assembled everyone who touched this project in some way, it was about 50 to 60 people. And many of those people were engaged in those sessions. So again, we had, almost 40 caregivers who, interacted with us, 15 sector stakeholders, and then about 10 SNAP-Ed folks who joined us. And we primarily focused on 5 states: Massachusetts, Colorado, California, North Carolina, and Oklahoma, which I'm realizing I didn't put on a star on the map. So sorry, Oklahoma folks. But we also engaged some folks in Minnesota and Florida, particularly in the healthcare realm, when we were trying to learn more about that sector. So I'm just letting someone in. Okay. So we wanted to share back kind of the key values and some key takeaways we heard from each sector. And some of them will seem overlapping or even redundant between. And that's because some of those values definitely transcended like physical locations or experiences. But for food retail, the ones that really stood out were COVID-19 safety. And again, this work was happening in July of 2020. So really when we were still in lockdown, when people were still doing things like wiping down groceries or really trying to limit the number of trips to the store. So that really resonated throughout everything we learned in the grocery store and also kind of rippled into the values. So another one that was really important was trust or connections within the store. So how safe does it feel? Can I trust my grocery store to be doing the right thing in terms of COVID protocols? Are there people in the store that I know and trust that can help me find things, that can be a friendly face when I go? Because a lot of people were really only making, very few trips outside of their homes, and the grocery store was one of them. When we started talking about what might look like helpful experiences or solutions within the grocery store, caregivers really mentioned like these need to be easy and low burden, and that caregivers really were being very planful before going to grocery stores to limit the amount of time in the stores and to make sure that they didn't need to make multiple trips. So planning and being able to budget before really came out as important values. So one of the things in the design process that we did was try to synthesize what we were hearing into insight statements that we can kind of start to ground our brainstorming in. And there were 2 that kind of came out of this work, but one of them was there's a lot to do and consider when I'm at the grocery store, like reading labels and checking my budget. It can be overwhelming and tiring at times, but I still really enjoy getting going because it gets me out of the house and helps me connect with my community and teaches my kids about food and finances. So again, we heard in those sessions that, going to the grocery store, involving my kids in the shopping and preparing a food at home is really important to me because I can impart those skills or share those skills with my children. And they were really wanting ways to engage their kids more safely within the store or at home. And we were always trying to kind of, at this point of the pandemic, try to hold that balance of what might be true now in this moment of pandemic that we're in, and then what might be true in the future. It was an interesting way to move forward, but I think I'm really glad we did this because I think that where we are now and where we might be forever might be a mix of kind of some things around COVID being true with some things kind of shaping and emerging, like doing hybrid events or virtual events. So from that insight, we asked caregivers, what would be interesting or what might map onto these values. And the two that were prioritized by them and people who worked with us during those stakeholder sessions were a meal box. So they were really interested in a box of ingredients that they could pick up that might be, excuse me, a set price every week to help them with budgeting. And might include some fun things in the box for their kids to do with them, like a puzzle or recipe steps that would be easy for them to do at home. So that was the first one that we kind of built out or brainstormed around. And then the second one was a rewards program that focused on how we could reward caregivers and families for buying healthy food items and participating in food skills education, either virtually or in the store, by providing things like cash back or fruit and vegetable vouchers. Oh, excuse me. I haven't talked out loud for this long. 1 second. Okay. So we didn't have time to actually test these ideas in real life and prototype around them. But what we did is we worked with a graphic designer to pull together all of these findings into a guide. Megan, can I hand it over to you while I drink water?
Yes, of course. So we worked with a graphic designer to turn this into a guide to say to our folks and to folks who are interested into testing this, how did we get here? And how might we test some of these interventions? So this packaged meal box or the idea of a reward system. So with this, you can see that we tried to kind of think through the steps that would be needed to be able to test it. You can see that we started with a checklist and kind of moved our way through. And so the link that I have dropped in the chat for the toolkit goes through the interventions and opportunities and how we got to them and how we might test them. And then the video link that I added in the chat as well speaks specifically to the I guess, sticking point sometimes with prototyping and testing, because those can be kind of difficult places for us to jump in. And then our intention, and we'll talk more about this as we get through what we found in each sector, but our intention is to not only have others test this, but then for from the Cooking Matters side of things, how might we work with partners to test and to better understand how these interventions would work. So that we can kind of also not just listen and hear about the ideas, but also test them. Claire, is it okay if I pass it back to you?
Yes, thank you so much. Yeah, so that was great. I really just wanted to show like one product or tool that came out of that work, again, was just, since we weren't able to actually test it or prototype it in real life, how could we give folks the tools to think through what we learned to kind of find out which would be the right iteration of these ideas to actually test in their local communities. So from there, we moved into education and specifically early childhood education. And the key caregiver values that arose in that sector or setting around what they might want in a health and wellness intervention included looking for opportunities to connect with other parents and caregivers. One of my favorite quotes that came out of the work was, "A problem shared is a problem solved." And one of the things that caregivers really, would like to see in the future are like listening circles or parent circles. And they really actually pointed to our caregiver sessions or design workshops as an example of a way where, something that they could see working for them, like coming together, talking through issues, brainstorming ideas, sharing resources with each other. They're also really looking for flexibility in content and format and time commitment. So that might be like a pre-recorded short video, a forum, maybe something to pick up at school and take home. Again, this might be something that is specific to the times that we're currently in. But one of the things that we heard throughout was that people really wanted health and wellness to focus on the whole person, particularly mental health. The caregivers we spoke to were, were paying attention to and concerned about their kids' mental health, about thinking through transitions back to school, thinking about kind of the general climate that we're all in right now, and the ways that we're working through mental health issues. So this came up really strongly throughout, was really like how, when we're talking about these, about health and wellness, it needs to focus on the whole person. They were also interested in providing or receiving nutrition education with a necessary service. So for example, one idea that folks really liked was having like a farm stand or meal box pickup at the ECE center so that they could check off, like grocery shopping or a trip to the store while also participating in a short nutrition education activity, or just in something that they have to do anyway, like pick up their kids. And then lastly, they were interested in tactile opportunities to learn and engage their kids at home. So again, one of the things that was a tension for parents was we want virtual or hybrid opportunities. And we are also concerned about the amount of screen time that we're all having right now, including our kids. And so kind of activity boxes or things that they could do at home with their kids were really interesting or attractive to them. So I'll just kind of highlight some things that I may have not said, but yeah, I mentioned they were really concerned about their children's emotional, social, and physical well-being. The pandemic had increased their overall sense of compassion and understanding for others, particularly their school staff. Many of them talked about how helping their kids with virtual learning actually built their own skills and capacity at home, but still some like IT support was lacking for them, or just like physical resources. And again, they were looking for things that would help kind of engage their kids in learning offline. And some of the cited barriers to engaging caregivers through ECE centers were language access. We forgot to mention that we did, we always had one kind of concurrent session in Spanish. So that came up a lot, where a lot of times kids would have to translate for their parents, or they weren't really receiving the same quality or types of information from their schools in Spanish. Transportation, and then lack of incentives for participation also came up. So what came out of our work in this sector is what we are calling the roadmap for SNAP-Ed engagement in ECE settings. So there were some prioritized ideas for interventions, like I mentioned, like doing a farm stand at an ECE center, doing kind of take-home activity box or recipe kits. But what we heard is that, it doesn't really matter what intervention you pick for an ECE center. If the infrastructure for a strong foundational relationship isn't there, then those interventions are not going to work. So what we ended up doing with our stakeholders and caregivers is building out, this roadmap for what would it look like to do SNAP Ed programming with an ECE center, because we know ECE centers have a lot of policies and regulations. They have their own cultural norms and values. And so this was really a way for us to kind of help SNAP Ed folks understand how to move through that, and then how to use SNAP Ed tools and resources to deliver programming in those settings. So this is kind of the 6 steps of the roadmap. And these 6 steps actually came from a design thinking activity called storyboarding, where we asked people to draw how we might do these experiences or activities in an early childhood education center. And what was really interesting was a lot of us kind of drew the same story. So those storyboards really became, those were like the first iteration or prototype of this more, designed map. And Megan, I think, dropped in the chat for that as well. Okay. I'm just gonna make sure. Okay, I just wanted to check the chat. So lastly, we engaged healthcare providers and caregivers around their experience in healthcare settings. And what we, the kind of big values and wants that we heard were, they really value authentic relationships with their healthcare providers and really appreciate it when healthcare providers can spend more time with them in the room. And they also were really wanting, culturally appropriate education, and education or learning opportunities that could be customizable to what's important to them and their family. Of note, about half of the caregivers we engaged in the sector had children who were medically complex or had, kind of health allergies that they had to work around. So oftentimes they felt like the types of information they were getting didn't actually quite map onto their unique challenges at home. So they really wanted something that was customizable. Again, we heard that they wanted flexibility in how they got this information, when they got it, and how long it would take to move through it. They were looking for opportunities outside of the clinic to learn, because a lot of them were really focused on like their questions that they had for the doctor prepared for that visit. And then they were also interested in getting support and assistance from staff in actually connecting with nutrition education or other opportunities for learning or support outside of the clinic. So kind of a referral. So one of the things, I know this is a little busy, but one of the things we did for each sector was had caregivers kind of share their experience through like a grocery store, with their ECE center, with their doctor or at their doctor's office. And so each sector, we produced these journey maps of what their experience was like moving through. And this one, for example, with Sasha's experience at the doctor's office, we found that most people have a pretty standard route through that experience. So we ended up kind of creating steps 1 through 8. But then we included things like, what did she really like about going to the doctors? So again, talking to members of my children's support network, like teachers and therapists, helps me prepare for my child's healthcare provider visit. And then we had things like the light bulbs were ideas for places in that journey where she might like to have more nutrition education, like meeting with a nutritionist while she's waiting for the provider, or getting text messages at home when she leaves. So these are some products that are in those toolkits that Megan shared. And the healthcare ones aren't online yet, but if anyone's interested, we can definitely share them. But this is one example of them. In this sector, we didn't really land with a final toolkit or guide. We had a much shorter time to do this, but we'll share a little bit about what the next steps are in a second. But what we realized is that caregivers and healthcare providers and SNAP Ed folks were really interested in looking at a pilot that might kind of carry nutrition themes and opportunities for connection from the waiting room all the way into another kind of virtual or in-person learning space. So a pilot of what we learned and a pilot of like this feedback and in terms of what would work or what would be desirable included using the waiting room to engage kids with screen time and maybe some hands-on learning, a QR code in the waiting room that would take caregivers to a screening survey to actually customize the content or customize the learning opportunities available to them. Maybe they register for a cooking class on their phone or while they're checking out. And then this is where SnapEd could really come in terms of providing nutrition education or some of that content they're interested in, either in person, or most people said that they would be interested in like a hybrid or virtual model. So this is just one example of how we could take all the things that we heard in terms of what caregivers want, what doctors would find feasible or viable, and then how SnapEd could bring in our unique skills and resources to pilot something in this setting. So I'm going to hand it back over to Megan.
Yeah. So as you've kind of seen throughout this journey, we've done a lot of listening to a variety of stakeholders in a variety of settings. And a big thing that kind of resonated throughout all of this was folks saying, we just want to make sure this isn't sitting on a desk somewhere or put up on a shelf gathering dust. And so we want to just acknowledge and hold space for that and say, we heard you. And so we really have been trying hard to think through how are we disseminating what we learned through this process, but how are we also taking it into that next step of prototyping and testing. So on the next slide, you will see that we're already starting to put some of our learnings in action. On the left side is a screenshot from Cooking Matters. So we've already started to put some of the lessons learned that we've heard about people's desires, their interests, their needs into some of our social media posts. So trying to really make sure that we are having our content be reflective of what we heard through this process. And then we're also starting to pilot things and ask for requests for proposals to pilot. So right now we have a request out if folks are wanting to pilot in the state of Florida for education, for the education setting, if they want to test any of the things we learned. And then we also are putting out a proposal in the healthcare setting to have folks kind of see what they might be interested in testing. So if you're interested or know someone or want to know more about that, you're welcome to reach out to me and I will put my contact information in the chat right now. But we have plans to test kind of everything that we've learned in each one of these settings to at least get it out there and start to see what would a prototype look like, what would testing look like. So we don't have any findings yet, but just wanted to, again, make sure that we had said, here's what we've heard. And we do know that the next step is testing it so that we can kind of get it into the field. And all the tools that we've shared and the links that I've provided allow it so anybody could do this, right? We are trying to put some financial support behind it, but anyone could take the toolkits, the roadmap, and the videos and put them into action with or without our support. Obviously, Claire and the folks, the team are here to help, and I'm here to help as well. But we are also going to try to put some financial and kind of person investments behind it to start to see what we learned as well. So Claire, I will pass it back to you to talk about dissemination.
So I won't read everything on this slide, but I did want to highlight, again, we are really working hard to get what we learned through this process out into the world. So it's not just sitting with us. We've been doing that through a range of professional presentations, collegial presentations with other folks using design thinking or doing user experience work to engage people. Especially people who might be eligible for SnapEd or SNAP, as well as other people who are in the SnapEd world who are interested in using these methods or using these learnings to put them into practice. And we've also been working on how do we share our learnings, our best practices with a wide range of folks. So Megan shared the Adapting Design Thinking Methods article that we published on Medium, so anyone can access that. We're also working on some peer-reviewed publications to reach more of kind of an academic community. And then we also recorded all of these short SnapEd or design thinking for SnapEd videos that are on YouTube for anyone to kind of learn a little bit about how to take these ideas and move them into testing in real world settings. So just wanted to share some of that. And Megan and Jared and I will be presenting at the ASNA conference, which is the Association of SNAP Nutrition Education Administrators annual conference next month. So again, really trying to build capacity within SnapEd to take these learnings into practice. I also want to plug that our team at FFORC at UNC, me, Molly, Tracy, we are really starting to think about how might we help other people write design thinking into their plans. So we really believe in design thinking as a method that is can be really useful for helping us advance health equity, for thinking about how we bring our users into program planning, design, and implementation, and then how do we actually build better relationships with our implementation stakeholders that we need to do this work. So if you're interested in learning more and help you think through how to write this in the plan, maybe you have a specific design question or challenge you'd like some help thinking about, we'd love for you to reach out to us. And our email is here, designforsnaped@unc.edu. And we'll share more about that in the coming weeks. So we just have one more kind of final reflection. We shared a lot of information with y'all, but we would love to hear what seemed most important from what we shared today. And if you have other ideas for where and how we should share it, so that again, the work that y'all have done with us can really have a large ripple effect out into the world. So feel free to unmute yourself or chat in a response, but I'll give folks a few seconds to think about it.
We have folks in the chat, so thinking about excited to see if the waiting room models can be pilot tested and developed fully as programming. So that is our hope as well. And then Claire chatted in, the focus on the whole person wellness is wanted and needed. Great. Love that we're speaking at conferences and getting the articles out. This is also the time in the space if you're interested to, to agree or to dissent. If there are things that, this is also your chance to share kind of what you heard and not only what resonated and where you think we should share it, but if there's anything that you just kind of have more questions about as well. Great, lots of chats coming in. So liking the roadmaps and the integration points within healthcare for nutrition education. So really liking the journey maps. Yeah, the desire for programs to be flexible and adaptable for each family's unique needs and goals. Oh, great. This is really helpful. Thinking about an article on the supermarket concept to be shared with the Retail Dietitian Business Alliance. Thank you for that.
Okay, great. Thank y'all so much. Well, finally, a big part of the reason why we wanted to bring people back or invite people back today was again, I know we've said this so many times, but seriously are just so humbled by all of the people who gave up time, energy, brilliance. Oh, I didn't even know that I had written that on the thank you card, but you can tell I wrote that before. But seriously, all of your time, brilliance, and energy to support this project and to learn with us. We were leading this process, but in no ways did we see ourselves as experts in anything when we started. And so I think other than bringing people together, maybe. And so just really, really deeply grateful for your trust in this process and all that you contributed. We really, again, are committed to making sure that this work moves into the world in multiple ways and channels so that, these ideas, these needs are really heard by multiple people. So yeah, Megan, I'll see if you want to add anything to that.
Just more gratitude. So thank you all so much. I know that this was a lot of your time to give and to share feedback and ideas, and hopefully it feels and has felt fruitful. And I think just kind of going back to some of the comments in the chat, but the importance of including participant input and needs, that was really what grounded us in this process. And so we appreciate participants' feedback as well as all of the stakeholders who helped us say, like, what would this really look like on the ground? So we're trying to kind of mix, kind of overlay desirability and feasibility and viability all at the same time. So thank you all so much. We are very grateful. If you have questions, myself and Claire are available. You're also welcome to reach out and let us know. And we have our information here, so stay in touch. And again, I put the UNC email if you're interested in their support with SNAP-Ed and design thinking. I put my email address if you have information around some of the Cooking Matters grant opportunities. And again, thank you, and thank you, and thank you. Anything else, Claire?
Nope, that was really it. We did want to share just some time and space if people have other questions or want to bring anything back up. But yeah, I want to just also give people time back if that's helpful. But yeah, do folks have questions or other things they'd like to share?
Okay, well, thank you everybody for all the comments in the chat. We will give you back some of your time as a thank you gift. Oh, it looks like, and we will, yeah. Bye-bye, everybody.
Yes, thank you
Have a
guys
great
so
day.
much. Yeah.